Welcome to The Source, where we combine the headlines with in-depth conversations with the newsmakers themselves. I'm Pinky Webb. Today on the program, the Philippines among the countries with the most number of coronavirus cases in the world and the country with the highest COVID-19 cases in Southeast Asia. Also, President Rodrigo Duterte mulls abolishing PhilHealth amid massive corruption in the agency. And despite repeated calls for his resignation, President Duterte wants the health chief to stay put. Live and exclusive, Health Secretary Francisco Duque joins us in the program. The country still tops the list of countries with the most number of confirmed coronavirus cases in Southeast Asia. On Sunday, records show the country has over 322,000 cases, of which over 40,000 are active cases. Experts see a downward trend, but is this enough to say that we are in control of the pandemic? Let's go straight to the source of the story. We have live and exclusive, Health Secretary Francisco Duque III. Secretary Duque, it's good to have you again. Welcome to The Source, and thank you for your time, sir.
Well, hi, Pinky. In behalf of the DOH, I'd like to thank you for your gracious invite. And it's really nice to be here with you. It's been quite a long time since I last joined you for an interview.
Which actually brings me to my first point, Secretary Duque. It's been a while since we last spoke, and I have to say that in the past, you've always been very accommodating with interviews. Why the hesitation the past month, sir?
Well, it's just that the COVID-19 pandemic response is quite demanding. And since I assumed the chairmanship of the Interagency Task Force. The Interagency Task Force has 34 national government agencies for its membership. And that's quite a lot. And it is really quite demanding. And since January, I assumed that position. And in March, the president declared a state of public health emergency. And so I had to lead in the efforts to ramp up our health system's capacity, increasing our laboratory capacity. Remember, at that time, we had to send even our lab specimen to Australia just to be able
I remember.
Yeah, you remember that, not just to confirm our first cases, imported cases of the COVID-19 virus. And so now we are 135 labs. And in March, we had about 6 quarantine and isolation facilities. Now we have 10,000 isolation quarantine facilities all over the country. And we have about 165,000 beds for isolation and quarantine in both the national and local government levels. And so we, because of this, we were able to significantly ramp up our health system's capacity to prepare us for a surge. And very effectively, the Interagency Task Force, which is led by the DOH, has been able to bring down the number of cases at about when we imposed the enhanced community quarantine in March, April, and there was a significant reduction in the number of cases. And we took advantage of that, from 400 to about 200 cases per day on the average. We took advantage of that while the cases were low and while we were at the ECQ status. We aggressively ramped up our health system's capacity, our isolation and quarantine, our labs, and our hospital capacity.
So it's because, Secretary, of the task at hand, and it Would it have also anything to do, Secretary, quite frankly, with the kind of criticism the government is getting, even you, of course, as head of the IATF, on how government has been handling the pandemic? Did you purposely kind of also stay away because maybe, some secretary, they say, less talk, less mistakes?
No, I was just really busy. And of course, while the virus or the pandemic was evolving, there wasn't much certainty about the quality of information we were getting from different sources. Even WHO, I mean, the whole world has been brought to its knees by this COVID-19 pandemic. And the information stream is in flux. It is dynamic. So it was very hard to pin down fact from speculations.
I want to go back to what you earlier said, Secretary. Let's go back to the early part of the pandemic. Just very quickly, sir. We had what? 3 cases. That was probably end of January or early February. And I remember speaking to you, sir, and you were very optimistic back then kasi napaka-konti pa lang ng mga kaso natin back then. But we are where we are now. Looking back, do you often look back at that time and think about what you could have done better in preparation for the pandemic?
Well, as they say, hindsight is always 2020, Pinky. No, but we must not forget that the first 3 imported cases we had was last week of January, and then it took a month before we actually recorded the first local transmission of the virus in San Juan Green Hills. So we had about a month that we didn't have any local transmission and much less a community transmission. So of course, there are lessons to be learned as always, especially when you're dealing with a new virus like the COVID-19. And so this is evolving. And so our response continues to evolve as well. But we're relatively doing okay, because even if you say that we have the most number of COVID cases in Southeast Asia, remember our death rate is low. We have managed to keep it low at 1.79%. Put it 1.8%. We are actually the third among the 20 countries, the third with the lowest deaths. And if you compare ourselves with the much more advanced and richer countries like Spain, UK, Italy, they have 5 times our numbers of deaths. No, so also I'd like to advance the fact that we are number 107 in cases per million population. That is equivalent to 2,904 cases per million, which is 3 times lower than Singapore. Singapore, for its 5.9 million population, is number 37 at 9,860 cases per million. So malayo, no? And then we are number 95 in deaths per million population. That's about 52 deaths per million, or 5.2 per 100,000 population, which is again more than 10 times lower than many more advanced and much richer countries, much more sophisticated health systems. No? So we have to look at it from a broader perspective and not cherry pick, the statistics.
Okay, I have 2 follow-up questions on that. The first is, we have 322,000 cases right now. And I do understand, even Secretary Roque often answers this, that we should look at the R0, we should look at the case fatality rate, number of deaths compared to the number of infections, which you said is at 1.7%. Be that as it may, sir. However, the country has 322,000 cases at present. Does that concern you as head of the IATF?
Well, we have to look at the recovery rate. Our recovery rate today is at about 85%. So I think that is the more important statistic to consider. We have known now over the last 6, 7 months or 8 months that about 90% are mild and about 5% are asymptomatic. And the rest would account for the severe and critical. So
Critical.
we are doing fairly okay in terms of our recovery rate. As I've said today, we have about 85% recovery rate. We have 273,079 recovered patients over 322,497. So our goal is to bring it up to about 90 to 95% recovery rate, and that is what the RATF is really focusing on. And hopefully, we could do a 98% recovery rate, but we have to really just do this very carefully, but also at the same time very aggressively, ensuring that the 5 strategic pillars of our pandemic response are put in place. This is the prevention, detection, our isolation, treatment, and reintegration measures. Okay, so we're doing okay. I mean, at least we're able to manage the death rate to a level that is far lower than most other and richer countries with more sophisticated healthcare systems.
But I want the follow-up to that, Secretary, and please explain this to us. You can compare us to other advanced countries with sophisticated healthcare systems. However, we could also compare ourselves to other Southeast Asian countries who have been very successful in their fight against COVID-19. Vietnam is there, and Thailand is also there. To what you mentioned a while ago, Secretary, yung iba ho kasi sinasabi, why not benchmark the Philippines to successful countries who are actually our neighbors?
Yeah, you're right. I agree. We should benchmark Philippines with our neighbors in Southeast Asia. But remember, if we do benchmarking, it must include what the available resources are. No? And let me tell you, according to the ADB latest policy data report, it shows that the Philippines is only number 6 in terms of the COVID response fund. So mababa tayo at they're saying 21.5 billion tayo. Look at Indonesia has spent or has a COVID response fund of about $115.2 billion. And then you have Singapore, $98 billion. And then Thailand has about $84 billion. And Malaysia, 78 billion. Tayo, 21 billion. Isipin mo naman, Pinky, ang resources natin are really much, much more limited than theirs. No? And so I think relative to our resources, we're okay. We're not doing fantastic, but we're doing okay. We're adjusting. I give credit to our people for their resiliency, for their compliance to our minimum public health standards. By the way, I'd like to inject that the masking, there's a survey showing that the masking rate of Filipinos has reached about 80%. No? So this is a testament to how well our people are adjusting to this COVID-19 pandemic.
Secretary, there's so much still to talk about, but we need to take a very short break. We'll be right back. You're watching The Source on CNN Philippines. Our guest today, Health Secretary Francisco Duque. Secretary, so if you're saying we're doing a okay job, that's what I've been hearing from you. You have also the Vice President, Leni Robredo, saying at one point that we are possibly even in a state of denial. Could we be in one way or form in a state of denial, Secretary?
I'm sorry, but I disagree completely with that. What we have been very transparent. We have been showing our data every day. We have We have done so much in terms of disclosures of all these very important information, and so I don't know what
Okay.
where the good
All
vice
right.
president is coming from when she says that we are in some
Uh,
kind of a state of denial. No, we
so we're
produce all
number
the data.
20.
As you can see every day. We show
Yeah.
the data. We show the active cases, the mild, moderate, those people in ICU with severe critical conditions. So I think we're doing our reporting in the most straightforward and transparent manner. But there's no denial there.
We're okay. Secretary, we're number 20. Ano pa, we talked about that a while ago, but we spoke to Okta also, and they're saying that despite this, Okta had said that we're actually seeing a downward trend. I think in the past 2 weeks, we're looking at about 2,700 cases. The past weeks, nothing, of course, I'd say to be proud about, but that only means among the 20 countries where we are, number 20, tayo lang ata yung country na parang bumababa daw yung mga kaso. My question is, are we headed towards the right direction? First one, Secretary, and number two, are we flattening the curve?
Well, the number one question, my answer is we're heading towards the right direction. And I say this because, again, all the investments that we have made in terms of ramping up the health system's capacity, our minimum public health standards, how should I put this? Our quarantine facilities, our contact tracing has improved thanks to the DILG's leadership that has been at the forefront of organizing the contact tracing at the local levels. And we're now at 1:5 to about 1:10 case per contacts per case ratio. So all of these have, I should like to believe, led to a reduction, although not by much, no? As you have said, this is about 2,004. It has gone down to about 2,400 cases on the average since September 22. We would like to bring this down some more, bring down the R naught. We're down less than one, our R naught score. I think you're familiar with what R naught
Yes.
means.
Yes.
Okay, so I didn't have to explain that, but it's good that the goal is to reduce it below 1, and we're at 0.85, 86%. And then our testing capacity, we've ramped it up, no? Like I said, from one lab, to 135 laboratories, and that's quite a dramatic increase. And our hospital capacity, too. By the way, the reason why we've also been able to bring down or manage to, at a very low level, our death rate is because of improved clinical case management. And I'd like to salute all of our doctors, nurses, and all who form part of the clinical teams in many of our hospitals caring for severe and critical cases. Plus, of course, the remdesivir, the Avigan, and many other new medicines or drugs that have helped reduce the recovery period for all these critical and severe cases of COVID.
Are we flattening the curve, Secretary?
Well, according to Okta, there's been a flattening of the curve, but it's at a rather not at a very low point. It's still yung stability point, medyo mataas pa rin. Bumaba siya. That's what the Okta report says, no? But not yet to a level that is significant. But however, let me just say that while we are able to see reduction in our cases, we are able to take advantage of that window of opportunity to increase our health system's capacity, decrease our critical care utilization rate. And we want to decrease that because we want to be prepared for future surge of COVID cases.
So if you were to describe where are we right now, Secretary, in terms of our COVID-19 fight?
Well, it's a very difficult question because, it's relative to so many factors. But from where we were from the very start, we've achieved a lot, I would say. And I'd like to thank the entire IATF for the collective effort, for the collective wisdom, for the NTF, the National Task Force headed by Secretary Charlie Galvez, and also Secretary Vince Dizon, Secretary Del Lorenzana, Secretary Ed Año, all of them, they have been at the forefront. And of course, our experts, no? Marami tayong experts na magagaling, no? And they've been all instrumental in really achieving milestones in our COVID-19 response.
I'd like to clarify, Secretary, have we flattened the curve, or are we starting to flatten the curve?
Well, we would like a downward trajectory more than the flattening of the curve. It's really, the goal is to have a downward trajectory. And we would like to just remember, Winky, this virus is going to stay with us. Huh? Let's not deceive ourselves. We're not going for the zero COVID cases. The two very important goals are to reach to manage the case transmission. No? We have to continue to crush the cluster, reduce the transmission, reduce deaths, and at the same time increase health systems capacity. Yun ang yon.
Okay, again. Okay, Secretary, you need to take another short break. We'll be right back. You're watching The Source on CNN Philippines. Our guest today, Health Secretary Francisco Duque. Sir, still a number of topics to talk about. Let me go now to PhilHealth. What was your reaction upon finding out that you are not part of the list that the task force PhilHealth recommended to be charged over the PhilHealth controversy?
Oh, I thought that was a very correct assessment or evaluation by the investigating bodies. The task force that was created by the president, led by the DOJ. And truth to tell, there's really no basis. I mean, all of these allegations, these are all baseless. And I can say this with the clearest of conscience that I had nothing to do with the resolution approving the implementation of the interim reimbursement mechanism. Although, of course, I knew what the objective was. And the objective was good because they wanted to capacitate all the hospitals to really respond to a COVID-19 pandemic. And the extent to which it was going to evolve was not known. And so I think the board then wanted just to make sure that the hospitals were ready, that they would not be stymied because of cash flow problems. And so that was the spirit behind the implementation of the IRM. But I was so busy as a chairman of the interagency task force. As I've told you, since January, I had been tasked to head the IATF on emerging infectious diseases. And my work is a continuing, challenge. And hindi madali. Mahirap ang maging interagency task force, no? People who might, as you can see on your screen, no? We've been going around making, hindi lang yung meetings namin that would last from 10 to 12 hours every other day every other day, doing resolutions, evaluating the recommendation from our experts, whether to escalate or de-escalate our community quarantine statuses. So this is something that really demanded so much more of my time, so that I left the PhilHealth. I was not able to attend many PhilHealth boards for almost 4 months, Pinky. For almost 4 months. From March, April, May, siguro mga last week of June na lang ako nakaka-attend nun eh. Kasi completely, I had to delegate the chairmanship to the PCEO because by law, the PCEO naman is the vice chair. So, alam mo, ang PhilHealth, ang Secretary of Health is chairman of 67 different bodies, no? Councils, commissions, task forces, committees, etc. Name it. So I cannot
Okay.
be there all the time. So I have to depend on
Okay.
my subordinates or underlings.
So, do you actually agree with the proposition to turn over the chairmanship of PhilHealth to possibly, for example, the Secretary of Finance? Sangayon ho kaya kayo dito? Kasi sinasabi niyo, you're basically saying your hands are full. I'm not hearing Secretary Duque. Should we take a
Yes,
break?
can you repeat?
Secretary, you're back. Sorry sir, nawala ho kayo. So dahil nga po napakarami yung ginagawa, do you agree na mas makabubuti po na yung chairmanship ng PhilHealth ay ipasa na lang sa, for example, the Secretary of Finance?
Well, I trust in the wisdom of Congress. You know, if they think that the time now is to view PhilHealth as more a financing insurance entity, and that the chairman should be the secretary, ex officio secretary of finance, that's okay with me.
Okay.
But for as long as they make him a voting member, remember, Pinky,
Yeah.
the Congress removed the voting right of the chairman of PhilHealth in the universal healthcare law. So I just want to underscore that very important point. And they should return that voting right to whoever they think will be the ex officio chair.
Okay. We have permission from the Secretary to extend this to our Facebook page because we still have a number of questions on PhilHealth. And I also want to find out from the Secretary what kind of scenario is he looking at for the country in November and December. So we'd like to say goodbye for now on television, but we will be back on Facebook immediately. Thank you for joining us here on The Source. I'm Pinky Webb. You're watching CNN Philippines.